All right, so welcome to Morning Report on this Monday. It's a child abuse morning report, so thank you to Dr. Brownell for the case and for being here for it. And I totally just gave away, that's definitely not the one we're supposed to start with. Okay, child abuse morning report. So we have a 6-week-old male who came to an outside ED because of an abnormal appearance of his left arm, per his parents. What more would you want to know?
What's the arm look like?
Good question. Let's see, 6-week-old male. So it's kind of limp. He's not moving it as much, and when he cries, he doesn't raise it like he normally does.
When did this all begin?
So mom noticed it this morning when the baby was in his like swing type thing.
Is the baby acting normal otherwise?
He's kind of fussy, but otherwise acting normal.
No fevers or anything like that?
No fevers.
Was mom with him yesterday?
Yes, mom was with him yesterday. And she's been the primary caretaker. Dad lives at home too, and helps take care of the baby, but he works kind of most of the day, like a 6 a.m. to evening time sort of work day. So yeah, mom was with him primarily yesterday.
Anybody else in the house?
No.
She notice any bruising anywhere?
No bruising that she noticed.
Was the baby born at term?
Yeah, so the baby was 41 weeks and 1 day. They induced her, and she ended up having a cesarean section for fetal bradycardia.
Difficult extraction at all?
No.
Did the baby receive Hep B, vitamin K, and erythromycin?
Yes, I believe so. I will note that the baby had a bit of a NICU stay. He was in the NICU for 8 days for things that are totally unrelated to his current presentation. But he did require CPAP for, I think it was like less than 48 hours that he needed CPAP. But he had some hyponatremia. That it was noted, I'm not going to write all this down because it's in the presentation, but it was noted that he had oligohydramnios at rupture of membranes, and he had some subsequent AKI from that, but nothing abnormal on his like urogenital sort of workup.
How has his growth and development been?
Oh, it's been great. Totally normal.
Does mom have any notable past medical history?
Not that I recall. She said that maybe she bruises a little bit easy, but her periods are normal and she had no postpartum hemorrhage or bleeding.
Any involvement of DHS previously for any reason?
Nope. Good question. And this is their first child, mom and dad.
Is this the first time the baby's been seen since leaving the hospital?
No, he'd been seen by his pediatrician twice, I think.
Any previous police involvement at all?
Nope. All right. Perfect. Let's see. Go back to this. Great questions, everybody. You definitely got the bulk of it. So the history provided by mom was that last evening they put him to bed around 8 or 9 p.m., which is normal. He goes to bed, I think, between like 5 and 6 for a little nap, and they wake him up between 8 and 9 to feed him one more time before like going out for the night. He sometimes wakes up once overnight, but not every single night. So they swaddled him, put him to bed at 9 p.m. Dad got up early. It sounds like they live on a farm and have some animals. So he got up early to go feed the animals, checked on the baby, but didn't feed, change, or do anything with the baby. And then between 8 and 9 a.m., he took the baby from the crib, fed him, changed the baby's clothes, and then passed the baby off to mom. And that's when mom noted that the arm was floppy. He just like was not really using it, wasn't really lifting it, which was definitely abnormal. And neither of them said that they knew why that was happening. And he was definitely more fussy, especially with that arm. So they took him to an outside emergency department, and they did where an x-ray was done that showed a mid-shaft spiral fracture of the left humerus. And he was then transferred to Barbara Bush due to concern for child abuse. So other history for the babe was that born to a 22-year-old G1P0 who was induced at 41 and 1. The oligohydramnios was noted at rupture. And the baby ended up having an unplanned cesarean section, as I said, due to fetal bradycardia and meconium stained fluid. APGARs were 6 and 8, and he developed respiratory distress requiring CPAP in the NICU. He also had a right-sided pneumothorax and needed a chest tube. While in the NICU, he had a sepsis rule out, an AKI, which resolved by the time of discharge, and SIADH and hyponatremia, which also resolved prior to discharge. For his parents, he's been really healthy at home, a good eater. He's been breastfeeding, pooping and peeing totally normal, gaining weight at the pediatrician. The parents can't supply an explanation for the injury. He lives at home, like I said, with mom and dad, but grandparents do visit usually weekly. And there was one day, I think, where grandparents took care of the baby primarily during the day. But otherwise, mom and dad are primary caregivers, and no prior DHHS involvement for the family. So from the physical exam here, I don't think it was noted at the outside hospital that he had this bruise, but a bruise was noted on the inside of his left ankle. So about 3 centimeter healing bruise over the left medial malleolus. And you can definitely tell. Yeah.
So just kind of a nugget there. So we can never really date bruises. We can't tell if it's healing or not healing just based upon the color or sort of the discolorations within it. So every bruise heals differently on every kiddo. So it depends on the location, the force, and all that kind of stuff. So that could have been done that morning. It could have been done a couple of days ago. We can't tell from the coloration. Sorry, just
You're fine. No, that's
important
great.
nugget.
Yeah.
And it's important to document in your notes, like don't ever write healing bruise or anything like that. Just say bruise and describe the color. Okay, I'm done.
Thanks. Otherwise, normal cephalic, atraumatic, his fontanelles were flat, no oral lesions or obvious frenula trauma. Abdomen was soft. He had good bowel sounds and no discoloration or bruising on his abdomen. But his left upper extremity was limp and seemed to be painful to him. He was uncomfortable with palpation or movement of that arm. It was also noted, I think, down when he was in X-ray, when he was getting his skeletal survey, that he didn't really like his his right lower extremity to be moved either. That was documented by his nurse who took him down. So there was some pain or discomfort there as well. And then the bruise on his ankle. So the plan was to do a skeletal survey, a head CT, labs, so CBC, coags, AST, ALT, PTH, vitamin D, calcium, meg, and phos. You want to rule out, try to rule out, make sure you're not missing a bone disease. Pain management, DHH consult, child abuse consult, and an ortho consult. And so this is actually from the skeletal survey at Maine Med, but showing the spiral fracture of that left humerus. And what was found on his skeletal survey, so one interesting sort of incidental finding was there was concern for maybe some dysplasia of his hips, which ended up being ruled out, but I just included that on there as well. And what was found was common metaphyseal lesions bilaterally of his tibia and fibula, which I might ask you, Amanda, to kind of talk about, because they're kind of hard to see really clearly, and so I thought you might be up for doing that.
Sure. You want me to do that now? So,
Yeah.
Okay. So CMLs are classic metaphyseal lesions. They're also known as bucket handle fractures or corner fractures. It really just depends how it projects on the film. It really is just kind of how the leg is angled compared to the plate. So these guys have, this kiddo has some pretty classic metaphyseal lesions. So you can see on the, so say look at the right distal tibia. Yeah, there you go. So see how there's like this little ring of bone here, and then it's separated from the majority of the bone by this very thin lucency. You can kind of see like there's bone, lucency, and then bone again. So that's actually a shearing injury, a separation of a very immature layer of bone cells. It's at that zone of provisional calcification, just to kind of get a little techie. So the zone of provisional calcification is not super well adhered to the rest of the bone. So when you have either a shaking or a yanking of that leg, you're actually separating that very immature layer of bone from the rest of the bone, and you actually can see that that is actually a fracture through that very immature bone. And he has it on the child's left leg as well. You can see almost this is like a textbook, looks just like a bucket handle. Here you can see that sort of that white bone, lucency, and then bone again. And then also interestingly, you can see along the shaft of the tibia, there's some periosteal reaction on the medial aspect. I don't know if you get, there you go. So if you follow that up, that's also healing. So that is telling us that there is fracture there. It's an indirect sign that there was a fracture of that tibia. So these were real classic lesions and super important reason why we do the skeletal surveys.
Unmute. So the skeletal survey did show the CMLs of bilateral tibias and fibulas, and as Dr. Brownell said, seem to be different ages of healing, and then the bruising on the ankle. It's hard to know without somebody saying without one of the parents saying when they noticed it or when it was inflicted, if it was related to the other injuries, but there is definitely a chance that it was related to the fractures. From an orthopedic standpoint, there was no acute intervention needed. They did end up splinting that left arm, and DHHS took custody, and the grandparents became guardians. And the plan was for a repeat skeletal survey just to kind of watch the healing in 2 weeks. And skeletal survey did show significant callus formation of around the fracture of the left humerus, indicating proper healing of that fracture. So the topic for today was the CMLs. And so as Dr. Brownell said, they occur generally when an extremity is pulled, twisted, or if a child is potentially shaken by an extremity and it's a shear force on the bone, and you end up with disruption of the metaphysis. And this diagram kind of just shows you location as where it's occurring and how the kind of extension of the metaphysis here is where you see that little corner. They're also called metaphyseal corner fractures or bucket handle fractures, as was already mentioned. And anywhere between 11 and 28% of non-accidental trauma long bone fractures are CMLs. They are highly suggestive of non-accidental trauma, as a shear force that produces them is not really a common force that a baby would produce on or exert on their own bones, especially a baby who's 6 weeks old. So here are a couple more pictures of, this is not our patient, but pictures of what they look like. They can be pretty subtle. They can also be a little bit more obvious. This kind of looks like our baby's distal tibia, where you have this lucency that's really sort of obvious. You have bone and then you have bone again, and an obvious sort of disruption of the metaphysis. They can be triangular or disc-shaped bone fragments. And as I said, it's just quite a bit more subtle than the spiral fracture. When you look at that humerus, you definitely see that and it jumps out at you, whereas some of these can be more subtle. So here's another example where you have kind of that triangular sort of shape of a bone fragment, and this is on both sides, which again is quite subtle, and this is the distal femur. And then just a couple more. Look at this little guy here. This is obviously in a baby whose ossification is still coming along, but you just have this little fragment here of the distal tibia, and then proximal tibia here. It's just that one's a bit more obvious. But I just thought having a couple of examples would be helpful. Anything to say about those, Dr. Brownell?
Yeah, like you said, they can be pretty subtle, which is, so this picture on the left of the baby's ankles may not even been picked up unless they did the lateral. So that's, we don't always do laterals on skeletal surveys, but some of the recommendations are actually coming out that we should start doing laterals of knees and ankles, because that's more commonly where we're going to see them, that and then on the wrists. But yeah, they can be pretty subtle, but they're super important forensically. Clinically, there's not much you do about these, and the babies may not even be symptomatic. So we get that question, well, wouldn't the parents have noticed that their legs were broken? And, babies aren't weight bearing, so we're not going to notice that. And they're not necessarily going to have any symptomatology. I mean, there was bruising directly over the ankle, which is a really nice indicator, but that's super uncommon. We don't know, you don't necessarily have bruising over these fractures.
Perfect. All right. I think that's all I've got. Thank you so much, Dr. Brownell, for sending this to me. I think it's definitely a really good case and something that everyone will see. So I will send everyone the Jeopardy video, because it's just great. It'll make your day so much better. And I hope everybody has a great Monday.
Can I ask a question? This is Colby Wyatt, and Amanda, this might be a question that you need to answer. Can you speak a little bit about accidental causes of these types of injuries? I think, we've had a lot of morning reports on non-accidental trauma recently. Maybe that relates to how much we're seeing in the hospital. But just so we can get an idea of causes that are accidental, or are these as pathognomonic as bleeds, retinal bleeds?
These are pretty specific injuries. There really isn't anything described in the literature that would cause this other than physical abuse. I mean, we always have to consider some sort of some others like metabolic bone disease or something like that, but in the setting like this, and it really is pretty specific, honestly. It's,
Okay.
it's not something we see outside of abuse.
And you're talking about the metaphyseal injuries, not necessarily
Yeah.
the spiral fracture, or all of it?
Right. Yeah, the metaphyseal fractures.
Thank you.
Yeah, no problem.
Dr. Brunel,
Yeah.
how do these fall under some specific Salter-Harris classification or no?
No, they're not, because they're actually not through the growth plate. They're through the metaphysis. So it doesn't affect their long-term growth potential. So it's not, sometimes they do get called as Salter-Harris when the radiology is looking at them, maybe someone who doesn't have a lot of experience, but they're not Salter-Harris.
Okay, yeah, I had seen that in the report and it kind of confused me for that exact reason, but okay, thank you.
Yeah. Usually that gets overread later on.
Thank you.
Thank you so much, Dr. Brunel.
Yeah, no problem. I'm sure I'll be seeing you guys around, unfortunately.